About your experiences there or what you would like to see happen, please let me know that as well. But today I was asked to talk to you about colon cancer. So first I would like to applaud you for wanting to encourage people's awareness around colon cancer. As you see, I have a model here. So I brought this model because I want to make this a little bit interactive. And outside of my work as a clinician and a health policy person, I'm actually most passionate about what I'm doing right now, which is coming into the community and talking to people to hear concerns and answer questions about some of the simplest things we can do to be healthy. So thank you very much for creating this opportunity. And I hope you all will cover many more topics, not just colon cancer. But colon cancer is a really important topic. And I'm just going to ask a question. Does anybody know what the most important thing you can do to prevent colon cancer?
Get a check.
Get a check.
So I heard get a colonoscopy. What else did I hear? Cleansing once a month. I should be writing this down. Yeah, I want to write this down. Okay, so get a colonoscopy, cleansing, and
High fiber.
eating fiber. Right, so diet. You have one, ma'am?
Just get yourself examined. Get an examination.
Okay, so that's in the bucket with getting a colonoscopy.
Oh, that's probably, okay.
Okay.
Hmm.
Ask and ye shall receive.
Mm-hmm.
Anybody else? So let's start there. What are the risk factors? Things that put you at risk for getting colon cancer?
Obesity.
I heard obesity, food. What about water?
You need to drink plenty of water.
Did you say water can cause colon cancer?
I heard that.
Yeah, we can tell, but
Just come on. Who said that water causes colon cancer? Can you tell us more about that?
What I'm saying is certain things they have in the water. That a whole lot of things that they have in the water that black people don't even know that they have in the water that they contain. That's happening in a whole lot of states around the country. And matter of fact, right here in DC water is not safe.
What's wrong with DC water? You're just laughing. What's wrong with DC water?
You got chemicals in the water, you know, you got chemicals in the water, you got a whole lot of things wrong with DC water.
Okay, I'm gonna have to get back to you on this. DC tap water.
With calciums and all this stuff where you got all these things around, bugs and all this stuff around, all this stuff is toxic.
Yeah.
So, you know, it's not safe.
Okay. I'm actually making these notes for myself, not so much for you all. So when we talk about risk factors for any kind of cancer, there are two buckets we put them in. And one we call modifiable, or things you can change, and unmodifiable, things you cannot change. Family history of colon cancer is something you cannot change. So it's really important to know your family history, because if you have a family history, and a lot of this applies to all cancer, but we're talking specifically about colon cancer today. If you know you have a family history of colon cancer, then it's important to get screened for colon cancer earlier, because if you find colon cancer early, 95% of people survive at least 5 years. If not many, many, many years. So the screening is really important. But in the modifiable bucket, I heard important things. Diet. So we can talk about diet, but smoking. Smoking is a very, very strong risk factor for colon cancer. And smoking is something we don't like to talk about, but it's there. And it's hard for people to quit smoking. What is the biggest reason it's hard for people to quit smoking? So let's say I decide I want to stop smoking, and then I quit cold turkey. What's the biggest factor in my relapse?
Stress.
Being around other people who smoke.
Smoke, yes.
So it's about changing your environment, which is really difficult for a lot of people to do.
Yes.
So these are things we have to consider and think about. It's not enough for me as a doctor to say, oh, stop smoking. There are many other steps involved in quitting smoking. But I would say to remember smoking as a very strong risk factor for colon cancer. And behind that, diet. Diet is also very important. So what should your diet be like? And what are examples of fiber?
Oatmeal.
So I'm asking these things because we hear a lot about health and health issues, whether it's online or you hear it on the news or in the media, read it in magazines, but we don't always understand the detail. So it is important to have high fiber in your diet. And why? What does fiber do? How? How does it cleanse?
Move stuff around.
Yes. What did you say?
Move stuff around.
Did you all hear him?
Yeah.
So, who wants to come up and be my volunteer?
Humana.
Come on up. So, when we talk about colon cancer, I love this organ model because I actually wish it came in brown, but I love this organ model because it is a conversation generator. Can you name these organs for people?
Lungs.
Stand on the side
Who
of
can't
that
see?
bed.
Okay. So, what are these?
Lungs.
Okay, so we're just gonna deconstruct this a little bit.
Heart.
What's this?
Heart.
What's this blue thing? Okay, so the blue thing, if the blue thing is the aorta, what's the red thing?
The vein.
So you have them backwards. So the blue is a vein, and the red is an artery. What's the difference?
Sides.
Arteries
is a big highway, the veins little highway.
One takes the blood into the heart, and one takes it to the heart.
Say that again.
One takes blood to the heart and one takes blood away from the
Which
heart.
one takes it to the heart?
The artery.
The arteries.
Artery.
That is correct. And the reason it's red is because it has a lot of oxygen in it. So have you ever watched a show, or maybe you've seen someone collapse and their lips turn blue? The reason people turn blue is because they're not getting enough oxygen in. So if they stop breathing, breathing is really critical because that's where we take in oxygen, the tissues use oxygen. If you stop breathing, all you'll end up with is a lot of blood in the blue vessel. So this is called a vein. It takes blood away from the heart, and it takes it away because it's getting cleansed in the rest of the body, including some in the colon. So the blue, once it finishes getting cleaned, it circulates back up to the heart. And the heart and the lungs act as a bit of a washing machine to get rid of the gunk. And then the red vein, or the red artery, starts to give that fresh blood with oxygen in it to the rest of the tissues. So that's what's going on there. Okay, what is this big thing, this big brown thing? What does the liver do?
Cleanse.
Cleanses. You guys know a lot. What about this green thing?
No.
The green thing? Anybody had this taken out?
Pancreas.
It's a gallbladder. What does a gallbladder do? You need the gallbladder to break down fats because it creates it spits out a chemical that goes into the body and it breaks down fat. So we eat those, fried chicken meals, Big Macs, gallbladder. Okay? What's this? You know all these organs. Who said small intestine? What is the relationship between the small intestine and the large intestine?
One filters out liquid.
So I heard one filters out liquid. So where's the small intestine? So this thing comes out. Why don't you take that out? This whole piece right here. Yeah, okay, so hold that up. These are your guts. So the gut is made up of, see all these little wrinkly things right here? What's this? Yeah. It's true. These are chitlins. Chitlins from a pig, right? The small intestine, that's why they smell bad. Right? They don't clean the chitlins before they put them in the store. But that's right. So in a pig, the small intestine is chilled. So the stomach, which sits right here, dumps right into the small intestine. And that's where food starts. So food begins to be digested from the time you put it in your mouth, comes in contact with acid in the body, and then it feeds right into the small intestine where it continues to be digested. Now I forget the length of the small intestine, but someone told me I think it's almost the length of a football field. Can you imagine that? Right in your stomach? Right here? If you were to stretch it out, it's very, very long. I need to get the exact dimensions for you. But after it gets through the small intestine, turn it around. Turn it around this way. It's hard to see on, okay, turn it back this way. I think because I have this tissue right here, and we'll talk about that in a second. The small intestine connects right to the large intestine, which is this brown thing. So this is your colon. This is what we're talking about today. So when you eat something, the journey the food is taking from the time it gets into your mouth, all the way down, back here, what's this?
Your boo-boo.
Yeah, this is a rectum. It's where the food's gonna start to come out. So all of this is a closed system that's moving food through. And it can take, depending on how fast yours moves and how quickly or not quickly you digest things, whatever you eat today, it could take anywhere from 24, 72 hours to get out. And that's because it has to go through all of this in order to get out. And the only reason thank you. That was great, wasn't it?
Yes.
Oh wait, I have one more question for you. Do you see this yellow thing right here? Everybody see that? What is that? How do you know all these things? What is it?
The pancreas.
What does the pancreas do? It secretes insulin, yes. And insulin is for what?
Diabetic.
To break down sugar. So if you have diabetes, you have a problem with your pancreas. But that, thank you very much. You can have a seat.
Very
Good job.
Take a bath.
The wonders of the internet. So the so it's about half a football field. Large intestine is so this brown thing, 5 feet long. Okay. The reason we're talking about the colon today is because, thank you. Colon cancer is one of the most frequent cancers we see. What's the #1 cause of cancer in the U.S.?
Diet.
Said the number one cause.
number one type of cancer in the US. It's lung.
Long.
Back to smoking. 80, if not more, 80% of people with lung cancer, smokers. It's probably higher than that. So we're being conservative. What's number 2?
Heart.
Breast cancer. Preventable also. And then colon cancer. So it's really important that we're talking about this today. So we talked about the importance of finding it early. So someone said get a colonoscopy. Who's had a colonoscopy? That's terrific. So what was that experience like? I just had my first colonoscopy and I was shocked. Yeah, but there's a lot going on when you get a colonoscopy.
Yeah.
I had a
The preparation was
virtual.
really hard.
The prep was hard.
I actually had a virtual colonoscopy, so I was awake.
Yeah.
And
You
it
watched
took
it.
less than 15 minutes. No, I had a scan. It was a scan, but I was awake and I went to work and everything. It was
Where
took
was
less
that
than 15 minutes. On K Street with Washington Radiology. So I didn't have to be put to sleep.
Who else
Yeah.
had a colonoscopy and had to drink something before a colonoscopy? What was that like? What'd you say?
The worst part.
The worst part. Well, why was it the worst part?
Since you feel like you had, what is, take all this at that point. I think you
It's difficult to drink all the fluid, right? What about people who may not have access to a house or a bathroom? Because you really need to be close to a bathroom, right? Yeah. It is a painful experience, metaphorically. I mean, not physically painful, but it is difficult, but it is very necessary because we haven't figured out, we are not technologically advanced enough for everybody to have access to the testing to see if there's a polyp, because that's what we're looking for. We're looking for early growths. And so the difference between someone who has advanced cancer in the colon and someone who just has a growth is that we just didn't find the other one early enough for a variety of reasons. So if you have people in your life who are at least 50, because the recommendations are to start screening when you're 50, but if you have a family history, it's recommended, especially for Black people, that we start at age 45 to get it done at least once so that you know, because if they find the small growths, they will take them out right when they see them.
Yeah.
And that will drastically reduce your chances of developing colon cancer. Now, my grandparents, except one, died very early. So when they asked me if I had a family history of colon cancer, I didn't know. So we also don't like to talk to our family members about health, what their experiences have been, but it's really important to talk to your family members about their health history and teach your children how important it is to understand what kind of health conditions are in the family, because that's really important information to pass on to your healthcare provider. So the colonoscopy, I actually just had this colonoscopy last week. It's really crazy timing since I was invited to come here and talk about this. But doctors are very good at prescribing things and then not taking our own advice. So I'm really glad I had the experience, because now I can talk with some credibility about what the person's going through, and you can do the same thing. Because some people are afraid of technology, they're afraid of going into the medical setting, but they need support. And I think even though we're a small group here, we can talk to people about how important it is to see about our health. Now, there's someone in my life who hates doctors. And he's been having issues, but he's afraid to go in. And I find this a lot with men. Not to single you out, but it's true. Am I telling the truth?
Yes.
Let's talk about that for a minute. Why is that?
That's their macho.
No, let's not hear from the women. Let's hear from the men about why are you all less likely to come in for prevention, to see if your prostate is okay, to get a colonoscopy, to check your x-ray. What's going on there, and how can we be better examples, especially for our young men who are coming up? So, go ahead.
I can't answer that because I go to the doctor for anything.
Okay, so we're not talking to you then. Yes, sir, you wanted to say something?
Now, you just don't want to hear the news, the bad news. Sometimes, you know, when you go in and you think you're doing good, and then when the doctor tell you, you know, with all the results and stuff, be like, it just makes you feel down. But when you don't know it, you don't feel down because you don't have to hear it, you know. But when you hear it, it's like, man, I got to change my diet. I got to do a lot of things that you're supposed to be doing, but again, you just don't want to hear it. Don't, you know.
And why might that be worse for men than it is for women? Because we don't like to hear bad news either.
No, the simple reason is men don't like to be bent over. So I think there probably is there's some truth to that with respect to the colon, but I'm talking about health in general.
That's it.
When I'm looking at my male patients versus female patients,
Men think that's a sign of weakness.
men think it's a sign of weakness.
They soft, we got to go to the doctor.
So going to the doctor is a sign that I need to write that down for myself. Because this is a really important issue that I think we have to talk about, especially in the Black community. There's nothing weak about admitting that something's gone wrong with your body, especially if you catch it early. I see this a lot with people who used to be jocks, you know, when they were 20 years old and they could run a mile in 6 minutes. And then they decide 30 years later, they decide they want to get in shape. And up here, they can still run a mile in 6 minutes. So they get up off the sofa and go try and do that. It doesn't work. Injuries, because then the injury keeps you out for even longer, right? So.
Body don't talk to you.
Sir, you wanted to say something?
I think the biggest problem is men who have colonoscopy. It's pretty hard to turn around and look, see what they're doing. And you know, you get skittish and about people talking about it. That doesn't help. They even saying that when I'm negative.
Do you have another one of these?
Yes.
Or I could just maybe write on a piece of paper. These are notes I'm making for myself because as we create programs, educational programs and messaging around health, I think it's important to incorporate this feedback, particularly in the health system. So you raised a couple of concerns. Weakness. You can't see. So it's like a black box. And then you feel like people might be talking about you. And you want to know what they're saying. Sir?
I'm so worked up that my whole system is shut down.
Nerves, that sound like nerves.
I didn't hear that.
I said my whole system is shut down, my whole body.
Oh, uh-huh.
I got myself
Yeah.
keyed up.
Right. Okay. Someone else had a comment?
A whole lot of guys just don't believe it can happen to them. They just don't want to believe it. Because,
I've heard this one a lot. This is invincibility. So how do we make the shift from I don't want to know, I don't want any bad news, to it's better to know now than to deal with terminal cancer? How do we make the shift?
doctor-patient relationship.
Is that enough? Enhancing the doctor-patient
You can't
relationship?
get a relationship unless you make an appointment to go to the doctor. But
There's some disconnect between, not, because I think there's awareness. I mean, you all know a lot of what I'm saying to you already.
it don't make no sense.
Because you've heard this or you've seen it somewhere before. But that doesn't translate to making you feel comfortable or feeling like you want to take the next step.
Yeah.
Yeah. Yes, ma'am.
I would think it would, spousal support, an encouragement would be pretty good, an important factor.
Would that work?
No.
Family and
Would that work?
because you want them around for the family, and that's
Yeah.
what you can say, we want you around.
So let's ask, will that work?
But
I don't think so.
Somebody telling you what you
nah,
want.
not really, because a lot of we as men, we don't really want to hear that. To be
Yeah.
honest, even though that's what we supposed. Like I know, for instance, me, one day, I found out I had diverticulitis, and my stomach hurt so bad. My wife was like, "You need to go to the doctor." I was like, "Nah, I'm gonna let this thing, run its course." So it wouldn't run its. She said, "No, you going to the doctor now. I'm taking you." So she ended up taking me, and that's what they found out, that it was diverticulitis. So again, if it wasn't for her, I might have would have just went on and hoped it ran its course.
Right.
But again, it was good that she did take me, so they could find out what it was.
So forcing them to go. What we need to do.
Yeah.
It's really be hard-headed because I have talked to a whole lot of gentlemen that about having colonoscopies. And out of a whole lot of guys, 3 of them came to me and told me, Clyde, thank you, kept pushing me because the doctor said if I hadn't came in, I wouldn't have lasted another month. So I had 3 or 4 or 5 polyps, they had to take out. And you just gotta keep talking, especially men. Men's got to talk to men.
Yeah.
Try to get them to go, get the test. Make sure they try to live long. Have a healthy life. But you got to stress to these men, to go get the test because half of them is not gonna do it.
Right. Ma'am, in the
I
back?
think that what it's the fear.
Can you speak up just a little bit?
Because I have a male family member, and I know it's gotta be because of fear, or something like that, because he feels that, he said, well, whatever goes in gotta come out at some point in time.
What does that mean in this context?
I guess whatever you eat or whatever, it's gotta come out. So that's how he looks at the whole thing, and it's, he would never, as far as he's concerned, he would never have a colonoscopy.
So is
And
this
he's
an,
pretty much healthy otherwise, but just going for that routine.
so is this an educational issue? Or is this an emotional issue?
I think emotional.
I think a lot of it is emotional because I remember not coming to work and the next day everyone saying, "Where were you?" Oh, I went in for my first colonoscopy, and it was just like, "You what?" It was,
Well, they felt like that was an abnormal thing to do?
yeah, like, what are you doing? Like, well, it runs in my family, so it's not sneaking up on me. But just their reaction, I thought was incredible. Why? One, it was me. You didn't have to do anything. You didn't have to drink all the nasty stuff. You didn't have to go get on the table. So I don't understand why you have this reaction, this drastic reaction to me going in for a colonoscopy.
So it sounds like there's some judgment.
And fear.
Oh,
And fear.
judgment, fear, but it also sounds like lack of information.
Yeah. But honestly, my father died of colon cancer. And his belief was,
Can you all hear her in the back?
my father died of colon cancer. And to his dying day, his belief was that a black man does not get sick. A black man does not go to the hospital because they kill you. And only way we got him to the hospital to get it checked is that he was so sick that he could not get up out the bed, and we had to call the ambulance. And he fought us tooth and nail. And the only way he resolved the issue that he was dying of colon cancer is that when he had They had to open up his stomach. We had to clean his stomach out. And he said, you know what? Maybe what my father